Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. The research I'm citing today comes from the journal Lipids in Health and Disease, Biomedical Central, published on June 12, 2017. So the study showed that supplementation with 3 grams per day of cinnamon for 16 weeks improved blood sugar regulation and other important cardiovascular risk factors in individuals with pre-diabetes, or more accurately, metabolic syndrome. So there's this condition called metabolic syndrome, but it's really a prelude into type 2 diabetes. So the participants in the study, this was a double-blind randomized control study. It consisted of Asian Indians, all of whom were diagnosed with metabolic syndrome or sort of a pre-diabetic condition. Now, Asian Indians are known to be susceptible to type 2 diabetes, as a particular genetic variant is quite prevalent among Asian Indians that predisposes many Asian Indians to insulin resistance. That means that their insulin receptors don't work that well. And this typically manifests into diabetes when these patients gain weight or they become less active. So with the economic liberation and urbanization and mechanization, the prevalence of type 2 diabetes has doubled in the past 3 decades in India, and early onset and severe cardiovascular disease is now frequently seen among the members of the population. So this research is very relevant, as it showed that daily supplementation with 3 grams per day, that's 3,000 milligrams of cinnamon, reverse many aspects of pre-diabetes and cardiovascular risk factors in a group of individuals who are at very high risk for type 2 diabetes and serious cardiovascular events such as heart attack and stroke. So let's look at the study. Compared to the group that got the placebo, the groups that supplemented with cinnamon saw the following improvement over the 16-week period. Decrease fasting blood sugar or fasting glucose. So it brought their fasting blood sugar down, less inclined to be a diabetic. It also decreased what's called the glycosylated hemoglobin. So when your blood sugar is high over an extended period of time, it sugar coats the hemoglobin in your red blood cells. And we call that glycosylated hemoglobin, or the hemoglobin A1C on the blood test. And the more sugar coating you have, the greater is the risk for diabetic complications down the road, like kidney failure and blindness and cardiovascular disease and the need for amputations, some serious stuff. So the group that got the cinnamon saw decreased glycosylated hemoglobin. Their hemoglobin A1C actually went down, which is a fabulous indicator of a decreased future risk. They also saw a decrease in their waist circumference, so their waist got thinner, and they decreased their body fat, and their body mass index also went down. To some degree, they also experienced a reduction in blood pressure, total cholesterol, a reduction in the bad cholesterol, the LDL cholesterol, an increase in the good cholesterol, the HDL cholesterol that actually reverses heart disease, and a decrease in blood fats, which are triglycerides. So overall, almost 35% of the subjects who used a cinnamon supplement saw a significant reversal in the parameters of metabolic syndrome or prediabetes, compared to only 5% in the placebo group. So how does cinnamon help? Well, experimental studies show that certain active ingredients in cinnamon can do the following. Number one, they can increase insulin sensitivity. This means that the pancreas doesn't have to pump out as much insulin because the insulin receptors are working better, so the body can clear glucose from the bloodstream more effectively. So the cells can now pick up blood sugar more easily, and that means that fewer carbohydrates get converted to fat. When your insulin levels are really high, the liver converts more carbohydrates into fat, and then to transport the fat over to the fat cells, the liver has to turn on cholesterol production and transport all that fat over to the fat cells. So that's a bad thing, because your triglyceride levels go up, and you're producing more fat, and you're producing more cholesterol that gets left behind in the bloodstream after the transport system has been executed. So you also see that it increases the release of fat from the fat cells. So these products in cinnamon, these ingredients, tend to get the fat cells to release fat into the bloodstream, so the body cells can burn fat in a steady state, which helps to facilitate weight loss and to make their waist circumference a little thinner. So that's a good thing. So the active ingredients in cinnamon appear to be cinnamaldehyde, a cinnamic acid, eugenol, coumarins, And these procyanidin oligomers of the catechin or epicatechin polyphenolic group. So very similar to what we see in green tea, these catechin polyphenolic compounds. Cinnamon has these similar types of compounds which show very impressive insulin potentiating properties, helping the insulin receptor work better so the body doesn't need to pump out so much insulin, and blood sugar can get into the cell more easily, and you convert less carbohydrates into fat, and you don't store as much fat in your fat cell, and you don't make as much cholesterol, and you help to improve that diabetic profile. So I did some investigating, and I see that you can purchase cinnamon in 500 milligram capsules from various supplement companies. A whole lot of companies make cinnamon capsules. So to match the intake of the participants in this study, you'd need to take 2 capsules of 500 milligrams each, 3 times a day with meals to achieve a 3,000 milligram dose over the course of the day, or a 3-gram dose. So if you have type 2 diabetes or pre-diabetes or metabolic syndrome or high blood sugar, then the best thing you can do is to get engaged in endurance exercise, aerobic exercise, or any type of endurance activity that'll help to burn fat and improve your insulin sensitivity. And then follow a lower fat diet and a lower glycemic diet so you're not spiking your sugars. This will help to improve your profile. But the study in the journal Lipids in Health and Disease suggests that also using cinnamon supplementation at 3,000 milligrams per day, it may further improve your overall blood sugar and cardiovascular risk factor. It'll be interesting to see how future research unfolds on this subject. So I've included a link to the cited research in the text below. So until next time, I'll encourage you to eat smart, live well, and I know you're going to look and feel great. Thanks for watching.